Hi, I'm Bella Bushby, the Health Promotion Officer at Positive Life New South Wales. Positive Life New South Wales is the largest peer-led and run representative body of all people living with HIV in Australia and is based in the state of New South Wales. I feel privileged to be presenting to you from Sydney, Australia to be part of the 2021 International Workshop on HIV in Women so I can share some of the insights of Australian trans women's awareness and testing for HIV. To start, I acknowledge the traditional custodians of this land that we are meeting on. I'm on the Gadigal land of the Eora Nation. I want to pay my respects to past, present and future elders and to sister girls, brother boys and any Two-Spirit people watching this presentation. I would also like to acknowledge and pay respect to the traditional custodians of the many lands on which we are virtually meeting today. Always was, always will be Aboriginal land. The other thing I want to acknowledge is my role as an ally to people living with HIV and trans and gender diverse people, rather than someone living with HIV or of trans and gender diverse experience myself. The work I present here today respects the primacy of the lived experience of community and their centrality and guidance in investigating this data. I'd like to thank all the people who participated in the survey and gave their time, experiences and advice freely. Positive Life New South Wales would like to acknowledge and thank the following organisations and individuals for their contributions to this study. When it comes to sexual health, trans and gender diverse people are recognised to be at a high risk for both STIs and blood-borne viruses, including HIV. According to the World Health Organization, transgender women, for example, are 49 times more likely to contract HIV than the greater population. Despite being recognized as a key population at risk for HIV, there is a paucity of research dedicated to trans and gender diverse people within the HIV response in Australia. One of the main problems is not knowing the actual prevalence of trans and gender diverse people living with HIV in Australia, as research doesn't accurately identify the numerous gender expressions, including non-binary and culturally specific expressions such as brother boy, sister girl, and or Two-Spirit. Trans and gender diverse people often bear the brunt of stigma and discrimination based on their gender identity and expression, which has significant impacts on their lives and healthcare. Unfortunately, this has led to a history of trans and gender diverse healthcare being characterized by a lack of understanding around how individuals identify their gender identity and expression. As the organisation that represents all people living with HIV in New South Wales, Positive Life approached the Gender Centre, which is the statewide organisation that supports trans and gender diverse people in New South Wales, to carry out this research in partnership. We conducted a trans and gender diverse needs assessment to investigate the current realities and needs of trans and gender diverse people who are living with HIV or may be at a high transmission risk of HIV and other blood-borne viruses. Throughout the process, this needs assessment was led and owned by trans and gender diverse people and was guided by an expert advisory group of 9 trans and gender diverse community members, with some members openly identifying as living with HIV. The advisory group provided the objectives and focus of the research, including advice and guidance into the survey design, range and type of questions ensuring appropriate language and peer representation, interpretation of results, and peer review of the final report. Our approach was informed by the principles of the greater involvement of people living with HIV and meaningful involvement of people living with HIV/AIDS. The anonymous survey was online between June and September 2019, and we recruited a final sample of 699 trans and gender diverse participants from across Australia. We use a strength-based approach, incorporating a mixed methods analysis highlighting the strengths, autonomy, and well-being of trans and gender diverse people who completed the survey. Trans women made up 40.3% of the total responses. To give you an idea of the diversity of our trans women respondents, we found that 19.9% were born overseas, 5.2% spoke a first language other than English, 2.5% were Aboriginal, half had or were working towards a university qualification, and 16.3% had a current or past history of sex work. The most commonly reported sexual orientation among trans women was lesbian or homosexual, followed by bisexual. In total, 3% of our trans women were living with HIV. We asked a range of other questions, however, given the amount of responses in the research report, I'm only going to focus on the few main points in regards to HIV awareness and HIV testing among trans women over the next few slides. While many trans women were engaged in HIV testing and were HIV literate, 39.5% of trans women had never had a HIV test. We were concerned to learn that 12.3% of trans women respondents had not had any HIV screening in 6 or more years, and 13.6% reported their HIV status as HIV unknown. Of those who have had a sexual health screen, only 51.8% of trans women received a blood test at their last sexual health screen. When we asked about PrEP and PEP, only 41.3% of trans women in our survey said they were aware of both PrEP and PEP, and this was significantly lower than our other trans and gender diverse participants. Of further concern, only 1.6% of trans women in our survey were currently taking PrEP. Trans women participants noted possible reasons for the low rates of HIV testing, which included self-perceived low-risk perception of HIV acquisition and discomfort within sexual health settings. A number also stated that they had never had sex and therefore considered their risk of HIV acquisition to be low. However, I need to note here that the definition of sex is different for everyone, and we didn't specifically ask that question for the purposes of this survey. Self-perceived risk for HIV was low in this group of respondents. To illustrate, I offer the following comments received from respondents highlighting some of the reasons they had never had a HIV test. Some expected and even relied on their sexual partners to be tested or believed they were not HIV positive. Some people highlighted they were in a monogamous relationship and stated they did not have casual partners. Others assumed their sexuality protected them, or they thought that anal sex was the only risk for HIV. A number of respondents assumed that if they had no history of injecting drug use, they weren't at risk for HIV acquisition. There seemed to be a perception that lower numbers of different sexual partners indicated they were not at risk for HIV. And lastly, one of the most concerning assumptions was the perception that because their loved ones or other close friends and family did not have HIV, they were protected. Furthermore, a lack of awareness around HIV transmission positioned people living with HIV as vectors of HIV transmission. It's important to note that these perceptions and views of trans women's awareness of HIV are of a few and is not representative of the entire community. These quotes from selected participants have been used to highlight specific examples of a lack of awareness around HIV risk. While the majority of participants were engaged in their healthcare and 65.3% felt safe or very safe within sexual health settings, 18.3% stated they felt either uncomfortable or very uncomfortable discussing sexual health with their healthcare provider. Participants felt especially uncomfortable when they were misgendered, and many reported feeling like they had to be the educator about trans health with their healthcare providers. Along with instances of stigma and discrimination, others described not being listened to, struggling with privacy issues, and assumptions made by their healthcare providers about their gender and sexuality. Gender dysphoria was also listed as a common reason for not having a sexual health test. And just under 1/3 of trans women relied on their doctor to initiate the conversation about sexual health. In conclusion, trans women identified numerous HIV testing and access to care barriers. Gaps in knowledge potentially contributed to low rates of HIV awareness, low rates of HIV testing, lack of awareness of PEP and PrEP, and low rates of PrEP uptake among participants. Some of these gaps included self-perceived low-risk perception of HIV acquisition and discomfort within sexual health settings. A number of participants reported positive experiences with their clinicians and general practitioners with whom they trusted and with whom they had built a respectful rapport and had a welcoming environment for trans and gender diverse patients. These clinicians demonstrated knowledgeable, supportive and clinical decisions on behalf of their trans and gender diverse patients. To conclude, the survey has created further opportunities for more valuable research to benefit the community of trans and gender diverse people. Some of the recommendations from the survey findings include a call for targeted resources and communication for trans and gender diverse people about HIV, trans-inclusive and specific sexual health clinics, trans and gender diverse specific medical training, and community-led awareness training for GPs and sexual health clinicians. That concludes my presentation. Thank you for your time and consideration. The research report is available on the Positive Life New South Wales website at www.positivelife.org.au, and this QR code will take you directly to the report. If you'd like me to send you a copy of the report, my contact details are on this final slide, and you are welcome to email me directly. Thanks.